Welcome to Rising Tide Startups, where today's most exciting solopreneurs share their startup stories. They also deliver tangible strategies that they would implement personally if starting their business over today. Each episode is a startup masterclass. Make sure you take notes. Take it away, Kevin.
This is Kevin Pruitt with another episode of Rising Tide Startups, and my guest today is Dr. Jonathan Baktari. Dr. Baktari, thanks for joining us on Rising Tide.
Oh, thank you for having me, Kevin.
We were talking a little bit off camera right before I hit the big red button, and I once again I have succeeded in having a classic underachiever on my show here. There's nothing in his CV that would stand out, but I would love for you to share a little bit about yourself, Dr. Baktari.
Oh, thank you. Yeah, so I'm a clinician. I'm a doctor, a medical doctor. I trained in internal medicine, pulmonary and critical care, and practiced clinical medicine. I had the good fortune of having other experiences in the world of medicine. I've been on clinical faculty in several medical schools over my tenure, and then had an opportunity to work for the hospital side. I was medical director on the hospital side and chief of medicine and other positions in the hospitals, and then also got a chance to work for health insurance companies, and so as medical director, and then finally, we started up a couple of healthcare companies and got to experience the entrepreneurial CEO side of healthcare, and so that's how we got to where we are today.
So I look back on your bio, and you started out like at Case Western and then went to medical school at Ohio State. Is that correct?
Yeah, so I went to Case Western Reserve University, just an amazing place. And I had an undergraduate degree in biology and psychology, and then went to Ohio State, which was another amazing institution, Big Ten school, and probably one of the best medical schools, I think, in the country. Just a top-notch program, which I think really built the foundation for my career. The education I got there, it was a very classic medical school experience in ways that I haven't seen many other places. And then I went to Northwestern University in Chicago for my internship and residency in internal medicine, and then I went to UCLA in Westwood, California, for my pulmonary and critical care fellowship.
Now, were these building on each other, or were these like you just wanted to have a more broad scope of, kind of your medical foundation?
Well, medicine is the way it's structured. If you want to be a subspecialist, you have to go down the general route. So you have to, specialize in, for example, if you want to be a critical care expert, you have to be an internist first. So it's sort of like if you want to work on mufflers, you have to be a general mechanic first. You got to kind of do the general stuff first. Otherwise, there's no avenue to become a specialist without sort of doing the general. So I kind of knew I wanted to do critical care and pulmonary, and doing internal medicine was the way to get there.
Now, was your time in Hawaii, was that before UCLA or after UCLA?
Yeah, so it was I got recruited really right out of UCLA. In fact, literally got a phone call saying, "Hey, we have a position in Hawaii, Queens Medical Center, as part of University of Hawaii in the ICU there in the intensive care." So that was my first position. That went well. I really enjoyed it a lot. And then subsequently got recruited to join a big group here in Las Vegas.
At what moment in that progression did you actually have MD after your name?
Right. The day after you finish medical school is when you get the MD. So it's a really amazing transition, because you go from being a fourth year medical student, and essentially, I don't want to say you're a nobody, but whatever, you're not a doctor. I don't know what you are. And then you graduate, and assuming you pass your boards, you graduate somewhere in May or June, and July 1st you start your internship, and all of a sudden July 1st, and all interns can relate to this, you're an MD, you're a doctor. So I have this really funny story. I remember my first day of being an intern. So the first day of being a doctor, and started at Northwestern University. And so we met the group, and they said, well, we have a call schedule, and Baktari, you're on call tonight. So first day of internship, I'm on call. And on call means, you get to sleep at the hospital. They give you a little room, and back then a beeper, and then you're on call. And I'll never forget, because, as soon as 5 o'clock or 6 o'clock came and I was on call, all of a sudden I got my first phone call. And it was really weird because it was from a nurse, and I vaguely recall the conversation. She's like, hi, is this Dr. Baktari? And I'm like, yes. And he goes, and something to this, like, oh, Mr. Smith is short of breath or something, and he's not doing well. And the only thing that could come to my mind is, why are they calling me? Like, why are you calling? Shouldn't you be calling like a real doctor? I mean, shouldn't you get someone on the phone that could help this poor person? And why
Believe
are
me,
you calling?
Mr. Smith wants a real doctor.
Yeah, Mr. Smith wants a real doctor. He doesn't want somebody who's first day of internship. But anyway, it turned out well. But that's what runs through your head when, as long as you said about the day you become a doctor.
So I was trying to and listening to some other like interviews you've done, I was literally trying to list some of the kind of the timeline and the trajectory, and my pen almost ran out of ink. I'm like, this man has lived like 4 lifetimes already, and he's only 32 years old. I mean,
Yeah.
what in the world? I mean, is how the trajectory seems to shift very quickly in your kind of your timeline. But it does sound like, it sounded like to me that you were rarely actively pursuing anything. It's like
Right.
these things just kind of happened.
Yeah, it's really amazing. It's I call it the one door opening up the next door kind of thing.
Yeah.
I don't know if that, and I'm sure a lot of people, when they look back at their lives, kind of have that experience, where they, I don't know, they take a yoga class and they meet someone at the yoga class that helps them start their next business, kind of thing. I mean, it's just sort of like one door opening, and that's really what it was for me. I think every experience sort of opened my eyes to the next experience, and so I think that's probably some of what you're seeing.
And it's amazing. I mean, so often we've talked about on the podcast with previous guests, I mean, nothing is wasted. It's like things build on each other, and it's you're kind of building this beautiful mosaic of experience and knowledge and aptitude and capacity, and I mean, I can see that it was a lot. I mean, it looked kind of, like this this waving river or whatever, but it was building on itself, and these were, one thing was related to the other. So I am really curious about the transition. I mean, I doubt that it was just like a bright light epiphany you had one day that just said, oh, by the way, I need to add business to my repertoire here. So walk us through kind of your
Yeah,
business transition story.
yeah. I think after I got to Nevada, and I joined this big pulmonary critical care group, and became a partner. I think I realized, so what's next? I mean, so this can't be it, right? Like, okay, now you're a partner, and so you're just gonna kind of just hang out and be a partner forever. And
You can only
so
play so much golf.
yeah, no, well, believe me, no, none of the part we were working long hours, but aside from that, so then I sort of initially got into, the just some positions of the hospital on committees, and then I became chief of medicine and head of one of the ICUs, and I think those administrative positions, you kind of opened my eyes to other administrative positions, which then led to other jobs in the healthcare insurance space, and then the hospital side, and it's just one position open of another. And I think there was this yearning, once you sort of get to the top, if you're a lawyer and you finally become partner, you just say, okay, well, I still need a second act. I can't have just the book end right there. And I think there was this yearning to have a second act. You don't want the whole thing to end right there. So I think it was just wanting to, I want to learn the next thing, and then I want to learn the next thing. And I think this just not being satisfied and say, okay, I'm here, let's park it here, and just do the same thing.
And I think you mentioned in another interview that you had, some administrative responsibilities and some, I mean, you virtually had run things,
Right.
before as well. It's not just like you're a worker bee in kind of the machine of the hospital or whatever, but you
Hmm.
really had responsibility to lead already. I mean, the stage
Right.
multiple times.
Right. No, but for other companies and other organizations and
Right.
huge corporations, so it's one thing to do it for them. It's another thing to step out and say, "Oh, I wonder if I could start from scratch and create a company on my own." And those are different skill sets
Hmm.
than what you have when
For
you're
sure.
an administrator and you're working inside of a corporation.
Well, you used a second ago. You'd used the phrase, we started a couple of companies. Who's number one? Who's the we, and what
Yeah.
are the couple of companies we started?
Well, the we is, me and my staff. I mean, I guess just me, but my organization. If heard some of the other interviews, the culture we have is, everybody in our organization is an owner. We don't have any filler positions, and
Mm-hmm.
we don't have nobody really works for us. Everyone is the company.
Mm-hmm.
So when I say we, I think we're just used to talking like that. But certainly my senior staff is part of the we. But no, we started E7 Health back in 2009. It was called the Vaccine Center, and we morphed it from another sort of idea that was there as a travel medicine company. We just came up with this idea to create a preventative health and wellness company that focused on adults, and mainly a lot of adult vaccination, uh, and a lot of adult preventative care. And we consciously opted not to do primary care or urgent care. So we weren't taking care of sick people. We were just doing books of business that kept people healthy.
Mm.
And as I've said in other places, we were like a COVID-19 company before COVID existed.
Right.
A lot of people who somehow got into the COVID business in one way or another pivoted,
Mm-hmm. Or
right?
started after the fact.
Or started, yeah, we're
Yeah.
going to be a COVID company, or hey, we were a telemedicine company now, but we're a telemedicine company, doing COVID.
Mm-hmm.
No, all we were doing were vaccinations and testing for different viruses and antibodies for different viruses, and that was the core of what we were doing before COVID hit.
Mm.
And so, if people didn't know why we were necessary before COVID, now they know. We do what would need to be done, for illnesses and things like COVID-19.
Now, when you talk about like travel medicine, or
Mm-hmm.
was this probably like if you're going to Kenya, you need yellow
Mm-hmm.
fever, you need
Right.
malaria, you need that type of thing. So is it kind of like the CDC meets the county health department type
Oh,
thing? I mean, fill that
you
gap.
well, again, with travel. So, yeah, I mean, if you really want me to unpackage all that, I can. So most people, I'm glad you're aware of it, but most people are not aware what travel medicine is. It's actually a specialty. There's textbooks on it. There's no board certification, but you can get certified physicians and other healthcare professionals. And basically, what it is, based on CDC guidelines, if you're traveling to anywhere in the developing world, certainly Central America, South America, the Caribbean, Africa, parts of the Middle East, or if you're traveling to parts of
Southeast Asia,
Asia,
yeah. Mm-hmm.
per CDC guidelines, there's a set of travel vaccines you need to
Mm-hmm.
get, some travel prescriptions you need to get, and some travel counseling you need to get,
Mm.
and specific to the areas that you're going. And so travel medicine is a field that came to being to basically fulfill all of these obligations that people should have when they're traveling, even to Mexico. I mean, per CDC guidelines, there's a whole host of things you need to do when you're traveling. And I think the misnomer is, oh, I already know what to do. I'll just drink bottled water. I mean, that's like one half of 1% of it.
Exactly.
And also what to do if you get into trouble. Where are the reliable hospitals in that country. And I know you've traveled a lot. I mean, some to Europe, but you've traveled a lot, and And this information is key if you're going to certain parts of the world. And
Absolutely.
so, yeah, so we initially started off as, an existing travel medicine operation, which just did that. And I think a big part of travel medicine is vaccines.
Mm-hmm.
And so, when we first started, we realized if you open the fridge, you have all these vaccines, but for adults, but travel medicine is not the only thing that adults need vaccines for. Some people need vaccines if they're starting certain types of allied health schools. You're going to be a pharmacist, you're going to be a physical therapist, you're going to be a nurse. You need a certain set of vaccines or blood tests for vaccines. If you're going to be working in a hospital or a surgery center or a hospice or a rehab, there are certain vaccines and testing you need. So there was this need for all of this, for different vaccines and testing for things, for all these different, we call it books of business, but that need was there and nobody was doing it
At
as
least comprehensively.
no, yes, and
Yeah.
everybody was doing it as a side hustle. Nobody
Mm-hmm.
was doing it
That's their
as their
primary thing. Yeah.
right, because they were also doing primary care and they were
Mm-hmm.
seeing sick people. And and by the way, we have these other services that none of us really understand, but we know a little bit. It's sort of like, I don't know, sort of like going to see your attorney who does probate, but now he's going to represent you in a criminal case, or whatever. It's just
I
nobody.
read a book on it once. Yeah.
Yeah, right. Or they have some familiarity. So everybody was doing it as a side gig. And I think part of it was, if you set up this whole system where you have doctors and nurse practitioners and exam rooms, you can't help but see sick people. You're like, well,
Mm-hmm.
we're already there. We have everything. How can we turn away sick people?
Yeah.
But we made a conscious decision. We're not going to turn away sick people. We'll refer them to some great primary care doctors, in our neighborhood or whatever neighborhood they're in. But we weren't going to do primary care. So if you walked into our clinic with a tummy ache, we would refer you out. And even though we had the doctor and the nurse, we just weren't going to do it because
Mm-hmm.
we really wanted to focus on preventative health and wellness for adults. And then, one thing led to another, and we started saying, well, nobody has the technology that we need because nobody does this. So we tried to use third-party software, off the rack, and it just didn't fit because we weren't doing primary care and we weren't billing insurance companies, and everything on the shelf focused on primary care and billing insurance companies.
Not
And
even for expensive vaccinations. I mean,
right,
it was just
well, I
all
mean, no,
kind of
because I mean, the way it worked is a lot of the travel vaccines are not classically covered by some insurance companies anyway. They're like, well, why should we pay because you want to go to a
right.
safari in Kenya?
Yeah.
Uh, but yeah, and whatever they reimbursed wouldn't, sometimes the reimbursements wouldn't even cover the cost of the vaccine
Mm-hmm.
that the provider had to pay. So it wasn't practical. Even if it was covered, if they pay you less than you paid for it, you're not going to be in business long enough to
Right.
give it.
It's kind of hard
So
to make money when you're losing money. That's
well, just to even pay your staff, forget about
yeah.
making money. But so it just, yeah, so the field lends itself, broadly speaking, to be outside of traditional health plans. But what we did is we tried to make it as affordable as possible because we were going to do a lot of volume, and we tried to make the experience, be worth it. So literally no wait time, everything's paperless. You register online, you book your appointment online, the results go back to you to your portal. And so we spent all of this time and energy and we also gave people a receipt of their services. So if it was a covered benefit under their policy, they could submit our receipt
Submit
to
a
their
reimbursement.
insurance
Yeah.
carrier.
Yeah.
So, we kind of built that into our system. So the people who could have it covered could try to get it reimbursed. But more importantly, we wanted to see if we could do it in a way that whether companies were using us, schools were using us, healthcare facilities were using us for their employees, or organizations were using us for their members, if we could provide them a service that literally had no friction, minimal wait times, and really let technology, let the patients or the clients be in control of almost everything.
There's there's kind of a funny story about people wanting Chick-fil-A drive-throughs to be the ones that are administering the COVID vaccines.
Yes.
I want you to be administering the healthcare administration in our
Yes.
in our government.
Yeah. Thank you.
I want to book it online. I want to show up,
Yeah.
have the service done, come back home, and with my receipt in hand.
Right.
I
Right.
mean, what
Yeah.
a great system.
Yeah. I tell you, nothing gets to me. I'll tell you the things that used to irk us, like I think we all have the experience of going into a clinic or a doctor's office and somebody handing us a clipboard with 15 pieces of paper of things that we filled out 1,000 times before. And you're like, really kidding? Really, 20 pieces of paper? I'm just here to whatever, get my teeth cleaned or something. And you're like, and so we said, there's got to be a better way. And then, this whole idea of like, if you need your medical records, why are your medical records with someone else? I mean, first of all, it's your medical records, right? I mean, so we just looked at Amazon and said, well, how does Amazon do it? I mean, if I want to know what I bought on Amazon a year ago, do I call up Amazon and say, can I have my records or what I bought from you a year ago? No. It's on the cloud. I log into my account. Oh yeah,
There's my
I ordered.
orders. Yeah.
That's the shoe I ordered a year and a half ago. And so we replicated that. So basically, we don't even have a medical records department because there's nothing we would ever do for you that you wouldn't already own, and you can download as a PDF by just logging into the cloud. So I mean, it was just trying to do that and getting rid of friction between the healthcare provider and the client or patient, where there's no friction. I mean, you are the customer, we're taking care of you. And people go to our website e7health.com and they're like, we literally have 10,000 reviews in 3 years.
Wow.
I mean, I don't know of any company in the world that has 10,000 reviews. And
they're probably good reviews. I mean, there may be companies that have 10,000 reviews, but they're all mad.
but yeah, right. They hate you. But what's interesting is people say, when people say like, this is totally fake, because I know I can spot a fake because I can tell the same person wrote them all. Because they all say fast, friendly, efficient, fast. They just kind of rechange the words. But that's really because it's the same experience. So it's funny how people think that. But I think part of it is if you drive through a Chick-fil-A, you're getting the same experience, and it's consistently efficient. And that's I think what we should all try to do in healthcare.
So, I mean, I love the idea and I understand the need for it, but this is one of these things that, I mean, it is an in-person service. I mean, you can't get a vaccine virtually. So how do you scale this idea? Is it primarily in Las Vegas? Did it start in Las Vegas and then you've gone to LA, you've gone to San Diego, you've gone to Reno? I mean,
right.
What's the plan moving forward?
Well, the big plan, first of all, is to make sure what we do is scalable. So we spend all our time, even currently, improving our technology. So when we first started, we had like 15, 20 third-party softwares to make the whole thing go. We've gotten rid of, the bulk of it was getting rid of the electronic medical records and the practice management software. So that we do ourselves. But we're just in the process of taking out more of it. I mean, we were using a third-party scheduling software. We're just in the process of taking that out. And each one of those is a 6 to 12 month endeavor. Because we have everything we do is on the cloud and Microsoft Azure, and and we have a full-time software development team. And before we roll it out, we want to make sure every part of it. We have an online university where our staff can train. So if you're the receptionist, you're the marketing person, you're the nurse, you're the medical assistant, we have separate university courses for you in our, we call it E7 Health University. So, and we're finishing and continuing to add to those coursework. So the idea is to make it scalable, button it up, and then expand. Because I think a lot of people come up with a great concept, and all they can think about is expanding. But if you expand and you don't have the technology to make it scalable and have the same experience, the same
Mhm.
quality,
Yep.
you're just expanding for the sake of expanding, and it may or may not work. But
Right.
we want to focus more on the technology and making it scalable.
I mean, I'm going to ask a question that I think my listeners may be wondering as well. Are there that many international travelers in Las Vegas that you could make? And if that's the case, I mean, is this a one-time thing, or do people tend to come back every year because they're going to different
Yeah,
parts of the world?
yeah. So again, the travel medicine, we call ourselves E7,
Mm-hmm.
and the E stands for, of course, the technology. The seven is really 7 books of business, and travel medicine is now one of the 7. So, let's just say that makes up 20% of our business. So
Right.
the other 20%. So we went into every book of business that vaccines were involved. So, for example, there's vaccines involved in employee health. There's vaccines involved in student health. There's vaccines involved in sexually transmitted diseases. So we're in that business because there's vaccines involved. So if the way I kind of look at it is, imagine you have a refrigerator full of vaccines for a travel medicine clinic, but you don't use it for anything but travel medicine. And the analogy I give is, if you wanted to open up a tire shop, right? And you had an inventory of all the tires, in the United States. I mean, every single tire you could imagine, but you only decided to only sell tires to Chevrolets. That wouldn't make a whole lot of sense. So if we're
Right.
going to have a vaccine full of a refrigerator full of vaccines, we're not just going to do travel. And that was the original idea. We're not going to do just travel medicine. We're going to do employee health, student health. We're going to do STD, COVID.
Mm.
We're going to do it all. If vaccines are involved, not only are we going to do the vaccine, but we're going to go vertical. So if we're going to give STD vaccines, we're going to do STD testing, and we're going to do STD treatment. So whatever vaccines were involved, just like travel medicine is not all vaccines. It's writing prescriptions, it's food, water, safety, insect precautions, talking about how to stay safe, what have you. So we provide all the services around the vaccines
Right.
in 7 different books of business.
So, I mean, I can see the travel health. I can see the kind of proactive front end part. What about I come home, I've got this bug from
Mhm.
drinking some lake water in
Right.
Uganda, or do you also work on
No,
that side of things? Or?
no, because that really would fall into primary care, and I
Mm-hmm.
mean, and infectious disease and tropical medicine and that kind of stuff. So we're all about preventing you from getting sick, and we're not against treating you. It's just we want to get really good at this.
Right. Right.
And I see a lot of doctors who are primary care, and they're doing Botox and weight loss and selling vitamin pills, and you can do anything you want, but we just want to do vaccine preventable illnesses, and whatever books of business that involves. And there's nothing wrong with other stuff, but we want to get really good at this.
It's kind of like the another Chick-fil-A analogy. I want to make that chicken sandwich really well.
Right,
And we can make that in 1,700 locations across the country.
right.
Tastes just exactly like it does in Atlanta.
Yeah,
But
yeah, yeah. And nobody goes to them and say, have you ever thought of serving tacos?
that's exactly,
I'm
exactly.
sure they could make tacos if they put their mind to it.
That's right. But let's get good at what we do. So,
Let's get
well,
good at what we do.
you
But
brought up the.
that's also an interesting thing, because like if you go to our website, or even if you go to Google and read our reviews, that's really all they say. Like, I cannot believe this place exists.
Mm,
I mean, it's
yeah.
it's just a repetition of where did this come from? And we wouldn't get those comments if we were Chick-fil-A making tacos.
Exactly. Exactly. Well, you did bring up the kind of the big C word just a minute ago, COVID. I mean,
Yes.
so, I've actually had my COVID vaccination, and I went,
Both?
went
Both?
in. No, actually, I had the Johnson and Johnson,
Oh,
so
you
I
got
just
the
had the
Johnson,
one.
right.
Yeah. So,
Good.
but I went in, walked into this massive airplane hangar looking
Mhm.
thing with a
Yeah.
10,000 of my closest friends, and got
Mhm.
the vaccination, got in my car and drove off. It sounds like to me that you're a for-profit endeavor. How does COVID vaccines work in an environment like yours?
Well, I mean, so right now we don't give the COVID vaccine just because it's, it's sort of mainly a government-run things, and I know they've signed contracts with Walgreens and CVS. So, but eventually, if COVID continues to be a month, yearly vaccine, at some point it may have a commercial use. But
Hmm.
we were in the forefront of COVID because we were one of the early companies that went national with home COVID saliva testing. So we set up
Okay.
in conjunction with a lab at Rutgers University in New Jersey. They were one of the first labs to get the emergency use authorization. So in conjunction with them, we set up a program where people can come to us, and we will overnight, and we did overnight through the height of the pandemic, COVID saliva testing, not the swab that you put in your
Hmm.
nose, but the saliva testing where you spit into a little tube, and then you would FedEx back to us and to our lab, and we'd get the results to you ideally in 24 hours or a little more than that, depending. And so that was our foray into trying to help with the pandemic.
Hmm.
Set up a nationwide COVID saliva testing where and what we liked about the COVID saliva testing is it didn't require someone else to administer the test. It was self-administered. So it was self-administered. It was done at home or at work. Many employers used us to reopen factories where they would
Mm.
order
Yeah.
saliva tests and literally have all the people who showed up at the factory come in and get one, or they would drop them off at their house, and they would, once they were clear, they would bring them back. So we were really excited, and all of that was our technology, because we had to do the software development, do the API integration, with the lab and with our patient portal, and in the height of the pandemic, we had our software developers like working overtime to set that up.
It is it is such a broad field, and I mean there's so much so many different opinions around this about what's the best course of treatment, what's the best course of prevention,
Mhm.
and I know that you've actually been on some TV shows and newscasts and things like that, asking specifically about this, and you've shared your expertise in this field. But I'm really interested in how you see the impact of this in the business world moving
Mm.
forward, and what how you think it's going to change the way we do business.
Well, I have mixed feelings about it, because I know it's going to change, broadly speaking,
Hmm.
and I think broadly speaking, I think it's going to change in ways that, for example, and I have mentioned this on other shows, like how the Great Depression impacted that generation,
Mm.
and how the World War II impacted, how the Vietnam War impacted a certain generation. Um, I can't. Yeah, I just can't imagine how this wouldn't be the same. I think surviving this is going to be similar to that, in the sense that you don't know how it's going to change, but it's certainly going to change you.
Right.
We always, I don't know if you ever met anybody's parents or grandparents who survived the Depression, and a lot of them couldn't never see like changing, giving up their a used car and buying a new one, because the used car was still running. I mean, until they ran into the ground, they're not going to buy a new car. And that was a mentality that came out of the Great Depression,
Mm.
and so and I'm not sure if you were in the Great Depression, you would have predicted that, but that you're going to evolve certain things. So yeah, broadly speaking, I think things are going to change somewhat. They have to, because of the nature of the event. Specifically, what's going to change? I call this pandemic the Great Accelerator. And as long as this is a business podcast or show, let's talk about that. I mean, because I think in many ways this accelerated things that would have happened anyway. If there's a certain department store that went bankrupt during COVID, someone could make the argument they probably would have gone bankrupt in 5 or 10 years
Yeah.
anyway,
Yeah.
and this accelerated that. Let's take technology. I don't know how many people heard of Zoom before the pandemic, and maybe they would have all heard of Zoom in 5 or 10 years, but this accelerated that.
Mm-hmm.
I don't know, no one had heard of mRNA technology to make
Mm-hmm.
vaccines, but it's been on the shelf for 10 years.
Yeah.
And maybe 5, 10 years, maybe we would have heard about that, but this accelerated that. So I think there are things in business that are going to be accelerated. Like, I just can't imagine going to a conference 2, 3 years from now, and there's a big queue of people to pick up their pass at the beginning of the conference. I just can't. I would imagine, COVID or no, the whole idea of just being in a big crowd for something as ridiculous as picking up a badge for a conference is probably, I'm guessing it may not be the
It's
same.
so 2020.
Yeah, right. Or just things that happened in 2019, like you go to a baseball game or a hockey game, and are there really going to be like 200 people between periods trying to get a hot dog and
Yeah.
standing in one little
Yeah.
will there be? I mean, so I think it will force technology to take that out. Not even because we can now. We know we could. Maybe they'll bring the hot dog to where you're sitting and you just
Mm-hmm.
order it on an app, right? I mean, why do you have to go in that queue, right? Because and just like Zoom. So the one thing that I do want to talk about, which again, it's just my little thing about it, is this whole idea of of are people going to be working from home, when this thing is over? It's sort of, I don't know if that issue has come up.
No, I was hoping you were going to touch on that. Yeah.
Yeah, I'm so contrarian on this. I'm sure everybody you've had has told you, oh yeah, we're all going to be working from home. Oh, Twitter sent everybody home, and Google sent oh yeah, forget, office buildings are going to be torn down and made into shopping centers or something. I don't know. I'm not convinced. I'm not convinced. It's all really good and fine during the height of the pandemic to talk about the upside of remote work, but I'm not sure it's really sustainable. And the reasons why I'm not sure it's sustainable, and I don't mean in all cases. One, a certain sector of the population whose jobs are not amenable to remote work.
Mm-hmm.
If I'm driving a bus, or I'm a construction worker, or I'm in the hospitality industry, that can't go remote.
Right.
I mean,
right.
how can I serve you dinner or serve you coffee or build your house remotely? I can't. So just this concept of the whole work for you, everyone will go live in Seattle or Minnesota, wherever they want, and work remotely. So once you realize a certain percentage of the workforce cannot, so you got to take them out of the equation.
Mm-hmm.
They just can't. You can't drive an Uber working remotely. You're going to have to show up. Okay, so that aside, and then I think there's a romanticism about remote workers, that every remote worker goes home and quadruples their productivity because they can be with their dog all day. I'm not sure that's true. I bet you some people go home and work less.
Yeah.
I mean,
Yeah.
it's a romantic.
Could be.
It's a romantic thing, but that doesn't mean everybody. And I'm not even sure. Maybe the majority do work more. But you can't say we send 100 people home, and all 100 are killing it at home.
Right. Right.
And I've never heard anyone talk about that. It's almost like it's not fashionable.
A taboo
to
subject.
say.
That's right.
What?
It's a taboo subject right now. Yeah, just
Right.
don't speak against that.
Yeah, and of course here I am. What am I doing? Speaking. No, but that doesn't mean all workers. So
Right.
Yes, or all staff. There are clearly freelancers or people who do bookkeeping and things that could be done remotely. But then I think the other part that really, it's easy during a pandemic to say remote work is cool.
Yeah.
But what about the culture? What about collaboration?
What about mental health?
Yeah. Just staying in your house all day.
Yeah.
So I don't know. I mean, be very frank with you. When at the height of my career, running from one hospital to another, there's a certain buzz. There was certain adrenaline.
Yep.
Who am I going to bump into today? of course, that could be, idiosyncratic, and what I learned from other people, the mentors I had,
Mm.
the people who taught me a lot. So yes, some people will stay remote, but I just have this feeling that this overly dramatic presentation that we're going to become some sort of remote workforce, given all of those things, is probably not the case. What is your, I don't want to interview you, but what have you been hearing from the people you interview? Is that sort of what is the preponderance of people thinking?
It's interesting because certainly these concerns that you've raised, people are cognizant of those things, but I think if there was a consensus, kind of a trend line that I can kind of identify, it's we're never going to go back to the way it was before completely. So we're never going to be back at late 2019, early 2020 anymore.
Mm-hmm.
And if you want to recruit younger talent,
Right.
they are starting to kind of demand this as part of the package.
Right.
And maybe it's a blended environment. Maybe it's I want to
Mm-hmm.
go to the office 2 days a week, and I want to work 3 days a week somewhere. I want to have unlimited vacation, but I know that I can't necessarily take it because I've got so much work to do. If I take unlimited vacation, I will fail to deliver and I'll get fired. So
Mm-hmm.
but it really is. I think there's a positive view of where we're moving toward, but
Mm-hmm.
I do think that it's not a complete full remote workforce. Never sell all the buildings, turn them into gymnasiums or apartment
Right.
blocks or whatever. So
Yeah, no, I think we're much more simpatico. I
yeah,
think yes, there's a certain percentage of they just don't need to be there, and I get that. But the ones that collaboration and culture and feeding off each other, that's a lot to give up for certain types of positions.
for sure, for sure. Well, you mentioned a second business. Can you touch on that just really quickly? I'm assuming it's a little more in the tech space. You said your
Well,
first one was tech space around healthcare. So
yeah. Well, it really evolved from E7 because one of the pillars we got into was drug testing,
Mm-hmm.
because most of the people who needed vaccines for employee health and needed vaccines for student health also they had to get drug testing as part of the whole package.
Right.
So like I said earlier, we started offering everything that went along
Mm-hmm.
with it. So we started developing software for drug testing. And what we did was we became literally, I know everyone comes on these shows and we're the Uber of this and we're the Uber of that. But we really took a page out of Uber because Uber, for example, has no drivers, right? They don't employ any drivers and they don't own any cars. So what are they? They're just a software that connects, the drivers to the passengers, and the drivers use their own car. So what we developed a nationwide drug testing company where we connected, all the Quest, LabCorp, third-party drug testing collection centers. So our customers and our clients could have access to, a nationwide network up to 15, 20,000 locations through our software, and they could order the test through our software and get the results through our software, and our staff could help manage their whole program. So that's literally a technology company that we, started from scratch and on the cloud. And that was a spin-off, a sister company that kind of grew because we had developed the technology inside of E7 Health. And then we just launched it as its own company back in 2015.
And it's a separate
Separate corporation,
standalone.
standalone corporation. Yeah,
And what's it called?
It's called US Drug Test Centers.
U.S. Drug. So, does it connect like companies like eScreen, that type of thing, or is
Yeah.
that kind of on its own, or?
Yeah, no, you would have access to eScreen's network. You'd have access to Quest's network. You would have access to LabCorp's network. You'd have access to everybody's. Third parties, urgent cares,
Right.
all of them connect to our software. So you don't have to pick one. And so literally you can order a test in any small town in the United States, any big town. We'll probably have a location a mile from where you're sitting.
I would not be surprised. I'm in
right?
an urban environment here. You may have more than one.
Oh
So
yeah, for
that's
sure.
right.
So, but that again was a technology play because there are other companies doing similar things, but we actually, wrote our own software
Hmm.
so we can literally, as our client, as we understand our clients' needs and wants, we actually become a solution, not just a product. So we just signed a major league baseball team. So we try to understand what they need, and we try to accommodate that because we're not a drug testing company. We're a software company
Right.
masquerading as a drug
Right.
testing company.
So I've got a question I'm really curious about. So I'm gonna dig down a little deeper in the psyche of Dr.
Oh my
Baktari
gosh.
here. So
I'm a very private person. This is very uncomfortable.
are you fascinated by technology, or is it just a necessary evil to accomplish what you want to do in the bigger picture?
No, no, I'm definitely, almost everyone who knows me, if they say, it's my birthday, everyone knows, like, I want something tech. I just, whether it's
The
photography
gadget
or,
guru.
it the bug hit me a long time ago. I think my first Apple laptop, I don't know, I bought 30 years ago or something or whatever. And I was in, I'm sold. So just realize, you know, technology can really improve, if done right, can really improve people's lives, can really, certainly in healthcare, can really improve patients' perception of their care, how they feel about their care, how much information they have about their care. There's really no way to have that level of impact on patients if you don't leverage technology. It's amazing. I think, whether, even if you look at one of these smart watches now that can take your EKG or
Yep.
your pulse,
Yep.
that would have been, that would have been Star Trek stuff 5-10 years
For
ago.
sure.
And and the way it's going, yeah, no, I love how I love being at the intersection of technology and healthcare. And that's a great intersection to be at because, I mean, anything's possible. Anything. So,
You've
yeah.
been in that moving intersection for a number of years. It's not like you just, the last 3 to 5 years, you just kind of
Hmm.
stepped into that.
Right.
You really have, even so many roles you've been on kind of the leading edge
Hmm.
of this movement. But I could sit here and ask you questions all night long, but
Hmm.
I do want to respect your time, and I
Well,
want to
thank you.
ask you, as we're closing, is there anything that we haven't touched on? Is there a call to action that you want to present our listeners with, and then just maybe close by telling where's the best place to find you
Yeah.
online?
Part of the reason I do some of these talks is we do it for educational reasons. Like,
Mm-hmm.
we're located in Las Vegas. It's not like we're trying to drum up business per se. It's part of it's just really education. And the last part of, the 6 months that, we were kind of coming up to the vaccine and finally the introduction of vaccines, really encourage everyone to get vaccinated. um, I can't, I know a lot of young people have vaccine hesitancy. I know a lot of people, when I say COVID vaccine, of course, um, but you got to really understand, we have to get this pandemic under control, both in the United States and worldwide, before a variant comes out. And we have to, it's like we're going to be starting the whole ball game over if that were to happen, if a variant comes out that's not covered by the vaccine. So it's a race between, getting herd immunity versus getting a variant that's not covered by one of these vaccines. So
Mm-hmm.
I know if you want to come up with reasons not to get it, that's easy to do, but I really, really want to encourage everyone, even if you're younger and you feel not vulnerable to it, you do it for people you love, do it for others. That would be my parting message. In terms of getting hold of us, you can go to e7health.com. You can go to bakhtarimd.com. I'm on LinkedIn. So those are all great places if you want to reach out if there's anything we can do.
Well, is that one closing question I do have about the clientele or the customer base of your U.S. drug testing centers or whatever. So, who is the ideal client? Is it these businesses or these individuals?
Yeah.
Who is this designed for?
Yeah. So the drug testing industry is kind of broken up into two categories broadly, irrespective of us, and that's mandated drug testing mainly by the Department of Transportation and non-mandated drug testings that corporations and different institutions like healthcare institutions want to do. So the Department of Transportation drug testing is mandated. Every truck driver, if you drive a truck, if you fly a plane, a boat, a train, anything that the public would be in or in contact with, you don't have a choice. You have to be in a drug testing program.
Right.
And that's federally mandated DOT drug testing. So we certainly take care of that industry, and all of those, all the industries within DOT that I just named are our clients. That's on the DOT. On the non-DOT side, we have just traditional healthcare facilities and other institutions that have drug-free workplace policies and have a drug testing program. So those are all clients. And lastly, we have retail clients, people who need drug testing because they're going through a divorce, child custody, probation, retail customers that need drug testing as part of that. And or sometimes parents that want to drug test their teenagers. It's pretty much runs the whole gamut. But in terms of our bigger clients, it's usually DOT or other corporations that are non-DOT but have a robust drug testing program.
And so you're the software behind this. So I'm assuming you've got some relationship worked out with all of these different testing companies that as you're referring people to their centers, there's some form of, for lack of a better term, an affiliate program or something like that?
No. So it's our account. So they're just doing the collection for us. So we are the drug testing company.
That makes sense. Okay.
So we're basically that we have an account with them. We say, we're going to send you our clients, do the collection, but we take the results and we manage the results. We also, we for companies that need random testing, we put all their employees in a metaphoric lotto thing.
I was going to say the big ball hopper.
and metaphorically, our computer does that for them every quarter or every month, depending on what kind of program they have. So we manage all of that. We write policies. So every company that's going to do drug testing needs to have a policy in place. Like, what happens if you test positive? You get fired, you get a second chance. Right. All those policies need to be written ahead of time. We do that. So we manage your policies and we do training. So we will train your senior staff to be the designated employee rep and other training that your staff who are running your drug testing program need to be compliant and not afoul of laws and in your state and what have you. So we do everything. We do from the drug testing to writing your policy to training your staff to managing and also answering your questions and helping you navigate audits from the Department of Transportation. It's a full service drug testing company, but the backbone of it is technology.
I am really glad I asked for that clarification, because I would have closed this interview and led my listeners astray. Maybe they had that same question.
Maybe that was too granular. I'm not sure if they wanted to know.
No. That's exactly you answered the question that I had. So I love really the whole idea from both companies that you really are a concierge. I mean, you're a full service agency that is built on the back of technology, and just love the fact that you have thought through these things so well and really met some felt needs and tried to meet where the need and the opportunity to meet really is exactly where good business resides. And Dr. Baktari, I just want to thank you for taking the time today. It's been a pleasure to meet you and to interview you on Rising Tide Startups, and just thank you again for playing your part in helping all boats rise in a rising tide. Have a great day.
Thank you so much for having me.
Another episode in the books. We hope you heard some great takeaways. Don't forget to subscribe and leave a 5-star review on iTunes and YouTube. As always, thanks for listening to Rising Tide.